Welcome to this evening's Town Hall on Mobilized Medicine. Feel free to stop me with questions on each slide. Thank you everyone for coming this evening. As you know, our healthcare system conducted a health needs assessment in our community. The assessment demonstrates the need for the delivery of healthcare services other than the traditional primary care framework. We've decided to use mobilized medicine, like other healthcare systems and local acute care facilities are using, to extend their services to the hard-to-reach neighborhoods. Even though our people are insured, there are people insured, gaps and barriers exist that mobile health clinics can resolve. When illnesses are not screened and diagnosed, they can lead to mental health challenges, which can lead to tobacco and substance abuse, further complicating one's mental health. Reasons for not seeking treatment are lack of time, trust in the government and in the medical community, as well as lack of transportation. Our two main goals are to reduce chronic illness and mental illness in the homeless and other marginalized communities. The mobile unit, by using best practices, will provide street-side medicine to screen, diagnose, treat, leading to re-entry for the homeless person into the health system. This leads to medication adherence, trust in the medical community, insurance sign-ups, and self-reliance. This project, overseen with investors, collaborators, and partnerships, will bring in an innovative delivery of healthcare to resolve chronic and mental illness in the community. The focus will be on clients with disabilities, depression, anxiety, also experiencing poverty, substance abuse issues, homelessness, and have no medical insurance. The overarching framework is to use case management for housing, screening, and diagnosing illnesses, then implementing a plan, referrals, treatment, and regular medical follow-ups. The following are public health approaches for the framework that have been designed for the project. The advocacy approach has the emphasis on the mobile clinic client and requires citizen participation in the planning activities. Those who help in the planning process can speak for clients with the health issues mentioned in the prior slide. What this means for you and I is that when we utilize stakeholders with the same health issue, we can remain focused on the actual problems. Like the advocacy approach, the communication action approach relies on those with the health issue to share information or their story so that we are invested and they are invested in the project. As such, this relinquishes power so all persons at the table are equal. One example is NAMI, the National Alliance on Mental Illness, a nonprofit for those with mental challenges, run by those with mental challenges. Last is a comprehensive rational approach. Like the former two approaches, this uses planners to set goals, identify alternative methods of healthcare delivery, implement programs, and monitor their results. This slide shows the CDC buckets of prevention that aims to improve health with community-wide interventions. We have also developed a plan using well-known public health theories to base our mobile health clinic project on. First is the knowledgeable neighbor theory, which requires the participation of the community, residents, just like you, and businesses alike. For the delivery of healthcare, we'll use population and patient-focused healthcare that centers its treatment on marginalized communities while focusing on what the patient wants and needs to make them whole again. This process helps them to gain self-confidence and self-reliance, thus increasing regular medical checkups and follow-ups, medication adherence, and participation and responsibility in one's own life. Systems theory and action research, which are embedded in the former theories, will require the mobile unit staff and client to participate in a detailed and deep reflection of their experience in the mobile health clinic project. Their reflection will be the feedback needed to provide us with the changes to be made, thus furthering the success, quality, and sustainability of the mobile medical clinic. To finance our mobile health clinic, we're going to be using CDC grant funds under the National Implementation and Dissemination for Chronic Disease Prevention Program. It will meet all of our financial needs for the initial costs, such as the purchase of the clinic and miscellaneous supplies. Our short and long-term financial plans will realize a 12-year savings in our financial healthcare system for every dollar that we invest in our mobile health clinic project. As you well know, public health aims to protect and improve the health of communities by way of detection and disease control. For the homeless and other marginalized populations, we must first screen, diagnose, and treat the individual holistically. Not only will this ease the financial burden on our healthcare system, it will increase one's health and quality of life. However, its success will require the assistance from you, our community, by the way of providing and planning input and feedback, by developing partnerships and collaborations, by volunteering, by donating physical goods or time, and much more. This is our project. This is our community project. Let's work together as a team to ensure that we leave no person out regarding healthcare, treatment, and any other services that are needed. Thank you for your attendance. Feel free to take a flyer on the way out, or you can stay to chat and ask questions if you have them. Thank you again for your attendance.